With Seven Sages Acupuncture and Herbs here in the city of Orange in Orange County, California. Today, I would like to share with you how acupuncture can help women suffering from PCOS and how it helped this patient of mine conceive naturally. So polycystic ovarian syndrome is a hormonal imbalance that disrupts the natural cycle of menstruation. Many women with PCOS suffers from infrequent or prolonged menstruation, or excessive androgen, which is a male hormone. If you have PCOS, the ovaries may develop a collection of cysts and fail to regularly release eggs. So now if you're not ovulating, you're not going to be able to conceive. So this is a 31 years old patient who, after her first baby, was trying for her second and was unsuccessful, and she was officially diagnosed with PCOS. When she came to me, or when she came in to see me, she was already on medications to help promote menstruation. But she expressed she was also worried that once she stopped the medication, her menstruation would stop, which she was right. It did happen because the medication for her did not treat the root cause of her PCOS. Her first treatment with me was on December 21st, 2019. And when she found out she was pregnant, it was before October 16th, 2020. It took us a total of 54 treatments, 10 months, and less than 3,200. That's including acupuncture treatments and herbs. And I usually don't talk too much about how much a patient spent, only because that's not the focal point of the fertility journey. But I remember this patient expressing that if she wasn't, and she said this in the fall of 2020, that if she wasn't able to conceive naturally, then she'll look into IVF. And you can fact check me on this, but IVF can range anywhere from 10 to 15,000 just for the treatment, and medications can range anywhere from 2 to 5,000. So comparing how much she spent with IVF, there's a big difference. And of course, not every patient will have the same result or require the same amount of time. So my protocol recommendation for natural fertility is I ask for 6 to 12 cycles after achieving optimal fertility balance. If you have no medical history and you're under the age of 40. If you have medical history or you're over the age of 40, I ask for 12 to 30 cycles after achieving optimal fertility balance. And we can discuss more about what optimal fertility balance is during the consultation, but there's a lot that goes into it, such as looking at your menstrual cycle, your stress level, your sleep, your diet, and then we go through all of that during consultation. But for IUI or IVF patients, I ask for a minimum of 1 month, but preferably 3 or more months before your egg retrieval date. And that's not the transfer date, that's the retrieval date. And I know my protocol can seem long, but I really believe in under-promising and over-delivering. And just like this patient, so she would fall under having medical history since she has PCOS, and I asked for 12 to 30 cycles, and she was able to conceive much sooner than 12 cycles. And this has been taught to me by my mentor, and I see this protocol work really well in my clinic. And it's not for everyone, but my protocol is made for those who are willing to do what it takes to not just have a baby, but they are willing to do whatever it takes to have a healthy baby and also be a healthy mommy or daddy. If you want to learn more about how I can help you, then consider booking a consultation with me. Here's the contact information. Text messaging is the fastest way to get a hold of me, but if you leave me a message, if you call and leave me a message, and then I'll try to get back to you by the end of the business day. You can also visit my website. There's a lot of information on there. There's fertility, cosmetic, there's also women's health, pain management. there's a lot of information. If you go on cosmetic, there's also before and after pictures for you to look at, and some blogs. So feel free to visit my website. I hope I can help you or someone you know who's suffering from PCOS or having fertility or women's health issue. Thank you so much for watching and listening, and I hope to see you in the clinic. Bye.